This is Outcomes, a show about uncovering the hundreds of micro-innovations that help make Australia's healthcare system one of the best in the world. On the show, you'll meet the doers, the Australian clinicians, care workers and healthcare professionals driving the micro-changes we seek to showcase. Theirs are the stories we're here to tell. I'm your host, Will Egan, and I'm the CEO of AusMed Education. I'm really passionate about improving the health and prosperity of the people in my community. I believe Australia does have a great health system, and every conversation we have on this show highlights why. Today, I'm joined by Rebecca Rundle, the Head of Learning at Ramsay Healthcare Australia. Imagine overseeing the learning experiences of almost 40,000 people across literally every area of healthcare, balancing career growth and development opportunities with the business's priorities and the myriad of quality and compliance frameworks that underpin the provision of safe and effective care. Where would you begin? The answer? Creating amazing leaders. Rebecca and her team identified that enabling and inspiring the people of Ramsay to engage with their leadership potential will universally support the business in all of its other endeavours. This is a great case study in how to identify, build, deliver, and evaluate leadership education in healthcare teams. Let's jump in. I'd love to begin by just asking you to introduce yourself and tell us a little bit about your background.
Yeah, absolutely. Well, hi everyone. My name is Rebecca Rundle. I'm the Head of Learning for Ramsay Healthcare. I lead our central L&D function, which is responsible for all of our large employee capability development programs. We are a centre of expertise and providing a shared service to the organisation. I've been with Ramsay about 2 years, and prior to Ramsay, I actually worked across a number of different sectors, including telco, fin services and professional services.
I'm curious, do any of those sectors have anything in common with healthcare?
Oh, absolutely not. To be honest,
they don't?
I spent my first 6 months in healthcare wondering what was happening. And that was really to do with, why is everyone so nice?
Oh, really?
Yeah, very different culturally, I think, to other sectors I've worked in. I think, when it comes to healthcare, people that choose to work in healthcare are certain types of people and very generally purpose-led, which I can't say is necessarily always true about other sectors I've worked in, from my experience.
Yeah. And Ramsay, even relative to those sectors where, we do have typically large employers across those other sectors you've worked in, Ramsay is an outlier here in Australia. It is the largest private health employer in the country, maybe almost akin to a government health department. I think Queensland Health has 40,000, but how many people are you overseeing the learning of at Ramsay?
Yeah, so we support approximately 35,000 employees.
That's huge, isn't it?
Yeah, it's a lot of people, and that's across 75 facilities, not taking into account all of our out-of-hospital services as well.
Could you tell us a little bit about the service environment? Is it mostly the Ramsay hospitals that we all see as we drive around the streets of Australia? What's the mix of services?
Oh God, I think if I was to hazard a guess, I would say approximately 80% of the organisation is clinical, and I would say our hospital facilities make up the greatest proportion of that. For an organisation of our size, we're considerably small given the scale of the organisation. But I would really, if I was to kind of divvy it up, I would say 80% hospitals, probably 10 to 15% out of hospital services, and then the sort of 5% really being corporate and shared services.
Okay, cool. And those out of hospital services, are they hospital in the home type services or?
Yeah, so things like our Ramsay psychology, pharmacy, mental health.
Yeah, so also quite a different set of regulatory or accreditation frameworks to also be across then from a learning standpoint.
Yeah, absolutely. It's quite a lot of sort of complexity across an organisation of this size. And it was only just recently I was just trying to get clarity about how many different job roles we have in the organisation. And look, I think every organisation's people data can be improved, but the data that I was able to get is approximately 580-ish different job roles across. So it's a lot of breadth and a lot of depth in the organisation in terms of what we do.
Yeah, fantastic. I was going to guess maybe at least 100, but 500, that's even surprised me.
And look, some of that's also because there are some, we've got a lot of work that we're doing at the moment in terms of our business transformation. So part of that is, we're moving to full integrated HRIS. So there will be some work done on standardization of job titles. But yeah, so there's already been some of that work done as well. So it'll probably condense a little bit over time, but we're still a very large organisation and complex organisation.
Yeah, absolutely. So take us through what things were like when you first joined Ramsay 2 years ago, and kind of bring us up to speed with where you're at now before we start talking about some of the projects that you've rolled out.
When I first joined Ramsay, the learning function historically wasn't really what I had known or experienced the learning function to be in the sectors that I've worked across. So the team at the time were predominantly responsible for the delivery of our clinical graduates program, the recruitment of graduates into that program, as well as student placements. On top of that, there were learning pieces that the team worked on or certain initiatives, but I wouldn't say we were a learning function set up with roles that were to engage with our stakeholders, to consult and understand their needs, to really drive and guide learning solutions, or designers to execute on those solutions. So the focus really was, the broader sort of clinical grad students, and we also looked after the compliancy learning, but that was really what the scope was back then. Over the last 2 years, we've really had quite a dramatic shift in terms of our focus. So we've really been looking to set ourselves up so we can support the whole of organisations' learning needs, really putting in place a process where we are proactively engaging and consulting with our stakeholders. One of the biggest challenges I think any learning function has is timeliness of when you can deliver a solution to the organisation. So there's always this desire to be a very proactive function, and it's really hard to get there because, if we look at Ramsay, for example, one of our biggest stakeholders is our clinical governance team. And sometimes the needs that they're going to have are coming out of, there may have been an incident or something may have happened where we need to respond appropriately and support with education. So yeah, we've really been trying to get ourselves to the point where we are to some extent proactive, but there is always going to be that sort of reactive nature given the nature of the organisation. And I think really of any organisation, I think everyone has those challenges in learning.
Yeah, absolutely. How do you KPI or think about like a proactive approach? How do you measure that? Is it something like responses come in, so there's a number of requests, and then is it about how quickly you can maybe fill those requests? Or
we're not at the point where we've put KPIs in yet. Some of the measures I'm quite keen to see within our team is if we consult to a part of the business that have a need and we deliver a solution for them, is not just an NPS score from our learners' perspective, but also an NPS score from our stakeholders' perspective. So how have they found engaging with us? Because ultimately we are a service provider to our broader organisation. They are effectively our customers. So we want to know when we're meeting their needs and expectations and delivering value.
And just to dig into that a little bit deeper, does each health service have its own education function? I'm not so much talking about, say, the preceptorship side of that, but more either the compliance or the development or learning as a standalone thing?
Yeah, absolutely. So most of our facilities either have their own facility educator, or there might be an educator or a team of educators that cover a group of hospitals. It really comes down to the size of the facility. For example, within pharmacy, there is an education team set up within pharmacy as well. So those roles are really focused more on what are those sort of localized needs.
Okay, and a few more questions just to set the scene. So I've always wondered this myself as somebody who's worked in healthcare for 15 years, but seeing as you've got those experience across different sectors, what's the mix of the areas of focus, or like what's been your experience about how we think as a healthcare sector about learning and development? And is it a compliance-centric paradigm? Is it a capability-centric paradigm? And how does that compare to those other sectors, which are also quite regulated in their own right, but not kind of in the same way to, say, telco or those other areas you've worked in?
What I've observed, and from my experience at Ramsay is, and this could be, I don't know if this is maybe Ramsay specific or more broadly in healthcare, the focus is always very compliance driven and theoretical based. So how learning has been done previously in the organisation has been really around the provision of materials, whereas I come at things from a learner experience at a sort of human-centered design perspective of what behavioural shifts do we need to see in our people. So, and that's really something I'm really looking to drive within the team is, when we're doing any form of capability build, it's not just about providing some materials and resources and go away and learn about it, really looking at how we can shift and change behaviours.
So essentially we have a default stance of knowledge and skills. Have they been given the information? Can they recall the information? And then skills side, competency, can they demonstrate that they can apply the information? But you're pushing that to that final kind of objective, which is, do they then go on to continue to practice that behaviour, change their behaviours, over time?
Absolutely. And I think part of, when we tend to, historically, when people think about learning, it's often what is the course, what is the resource that's available, what's in the catalogue in the LMS. But, I suppose I look at learning a whole lot more broadly. We often talk about Josh Burson's learning in the flow of work. So what are the performance support tools and resources that you need at that point of need, as opposed to, what's available on a catalogue or what's on a course calendar that's published somewhere. So I really have a view that learning is far beyond, courses and catalogues. We've done a lot of work recently for some of our programs, sort of driving behavioural nudges and little comms campaign that sits around it, which will drip feed bits of pieces of information in a timely way that might prompt someone to do something or consider something or have a moment of reflection.
Yeah, so a very holistic approach, a post-learning aspect as well, providing those nudges post-learning for, one at 1 day, one at 3 days, 7 days, 30 days. People's knowledge retention and then intention to change practice, is much, much higher, orders of magnitude essentially higher than if you administer the education and just hope that they go on to change their behaviour. Come back a week later and it's back to how it was before the education was provided.
Absolutely. Like there's so much we've got to do even to prime and ready someone to participate in learning. So when I think about any sort of learning intervention, I'm thinking about, the learning could be, a 6-week component that sits within it. But I'm really thinking about, well, what's happening in the couple of months before we're engaging with them? What's happening in the months following? And what does that end-to-end experience need to look like to start to drive behavioural change?
That was really the catalyst for us coming together to have this discussion, was around an example of that in a leadership program that you've been established at Ramsay and has been rolling out now for 6 months or a year?
Yeah, we're at 6 months now, and we've had 10 cohorts across 5 different programs go through the program, and I think we're on track by the end of July to have 282 leaders complete an academy program.
Wow. So let's just step back a little bit, and if you could frame up, why is this needed and how did this come about as an area of priority?
Like most organisations, we're going through so much change and transformation, and really strong leadership bench strength is really pivotal to our success as part of our change and transformation. There's also leaders play such a key role, and strong leadership capability plays such a key role in terms of employee engagement, retention, and ultimately your culture. So for, where we're at as an organisation, it really was important to us to really ramp up our investment in our leaders and that building up that capability.
Okay, and how did you pick up on this as a need? What was not happening, the thing you weren't satisfied with that made this a priority? Yeah, how do you see that play out when you don't think there's strong leaders or leadership capability available to the organisation?
Yeah, I suppose it was not so much we didn't think there was strong leadership capability, because what we've seen through our academy programs is we actually do have some really great leaders, but what we didn't have was absolute clarity about what great leadership looks like at Ramsay. So a number of years ago, we used to run a couple of different leadership programs, and they were discontinued. Things were put on hold generally as a result of COVID. As we came out of COVID, we ran a program of work, which were leadership masterclasses. So this was our first sort of foray back into leadership development. And that was giving all leaders across all levels of the organisation access to masterclasses covering a range of topics from difficult conversations, developing your people, managing change and ambiguity. So we'd done that piece of work, and we really were then looking at, well, how do we now take this up to the next level? So that's what really brought us to the point where we determined, yes, we want to stand up a leadership academy and really do this well across the organisation. But that first point was really being clear about what does great leadership look like. So to get us there, we did quite a lot of work consulting across the organisation, lots of focus groups and input, and we landed what is called our Care Leadership Foundation, which is, in its purest sense, is a leadership capability framework. But, for anyone that's not in HR, as soon as you say capability framework, you see their eyes gloss over. And, I get all sorts of excited about this sort of stuff, but we really needed to make it real for people. So Care has 8 capabilities, and there's 2 that sit under each pillar of Care, and that spans 4 levels of leadership. And Care stands for coach, achieve, relate, and evolve. And we really wanted to make it simple and land on an acronym that was actually going to resonate for our people. So, our ethos very much is people caring for people. When we landed Care, that just felt like an absolute, I suppose, really a no-brainer for us. That was something that would be memorable for our people, but went to the detail and articulated all of the behaviours that are expected for leaders across all 4 levels.
It really taps into that intrinsic motivator that everybody has who works in health.
Absolutely.
Yeah, I think workforce capability, it reminds me of the Bluey episode where the dad's telling the kid off and all the kid can hear is blah, 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 go to your room, blah, blah, blah. It's workplace jargon, and it's not going to get someone excited to engage, unfortunately. So packaging it up into the actual objective, bringing the objective forward, which is this helps us provide better care, it sounds like a great move. It's always nice as well when the acronyms that you can make with the words you've come up with actually have meaning versus set of letters that don't actually mean anything as well. But, so we've got coach, achieve, relate, and evolve. I remembered the first and last, recency and primacy, not the middle 2. And then there's 2 capability statements underneath each, or 2 capabilities under each pillar.
Yeah.
And then there's 4 levels through that. So people graduate through levels as part of the academy, is that?
So the levels within the framework are defined by their level of leadership. So we've got emerging and frontline leaders, people leaders, leaders of leaders, and senior and executive leaders. And as you progress in seniority, so let's say, for example, if you're a NUM and you move into a DCS role, the same 8 capabilities still apply. They just increase in complexity because of the breadth and scope of your role. So we've built the Care Leadership Foundation so they are an incremental build upon each other. It's not to say that, when you're a more senior and executive leader, you're not doing some of the things that, you still would be doing as anyone who's leading people. It's just some of the other things you might be doing might be a little bit different given the scope of role.
And are they expressed as behaviours or
yes,
a mix? Yeah, tell us about that.
So there's a set of behaviours for every capability. The way we've brought this to life for the organisation is we've created a digital magazine which actually articulates all the different behaviours for each capability. But then we did quite a lot of work with some of our leaders, interviewing them. So we've done videos, we've had written stories, and really getting them to share their experiences about how they live that behaviour on a daily basis. So, for example, one of our capabilities is sets direction. So when I was kicking off this piece of work, I was, engaging like some of our NUMs and DCSs and saying, look, these are the behaviours, and here are some of the questions that I want you to think about. What resonates with you, and what can you tell a story about? So they selected a story, and we've brought that to life either in a written format or a video. And the reason we did that is I needed to really humanise a capability framework and bring it to life for people. So what I was trying to achieve is, irrespective of your role, you would be able to watch one video across the capabilities and go, they're like me. I understand what they're talking about. So really, the storytelling is such a powerful way to help things stick.
And help people relate to it as well.
Absolutely.
So there's a behaviour statement. What's the education, the training, the knowledge and skills bit that sits around each capability as well?
So when we've designed the Leadership Academy programs, and we've partnered with a company called Impact International on the design and also on the delivery of the programs, they have designed every program, all 5 programs, around the Care Leadership Foundations and for the level of leadership that program is targeted to. So as we launched, what we actually chose to do was launch the academy first and teach people about care through the academy. So we're still only 6 months in. We will likely take a more proactive approach with rolling out the care leadership foundations. And what we will be doing in the longer term is embedding those into our recruitment processes for leaders, as well as our performance process as that is rolled out across the organisation.
Okay.
So it will become a bit more proactive in terms of how we educate people about it. But yeah, we made the conscious decision to launch the academy and let them find out about care through almost quite organically, deliberately, but organically through the academy programs. Because the risk was just, saying to everyone, ta-da, Care Leadership Foundations is here. They go, oh yeah, great. So what?
How do you drive awareness across the organisation? How do you drive awareness across the organisation of the framework and the academy?
We're not at that point organisation wide just at the moment. It's something that I will be working through in the coming months with my director in terms of how we are going to do that. But what we have done, and I suppose in its really sort of simplest form at the moment, is we're quite actively sort of posting on LinkedIn. Our CEO has a weekly newsletter where we will, there's always opportunities to promote the academy, but also promote care. So that might be a channel that we look at down the track. Even in all our comms, there's always a call to action at the bottom, directing them to some of our leadership resources, and we've built a leadership toolkit as well. We tap it onto everything, but it hasn't been a proactive drive just yet per se.
Okay. And for the people that have already gone through the programs, is there some way for them to communicate to their colleagues when they're back out on the ward that they're part of care?
Absolutely. So we've actually designed that into all of our academy programs. So each program's a little bit different in structure and how it's delivered. So some of our programs are virtual and some have virtual and face-to-face. But between each learning event, be it face-to-face or virtual, we have a mechanism called a peer coaching circle, which is a group of 3 to 4 people within the same cohort, and they have a number of different tasks and reflective activities to do between sessions. And one of the activities that they've had to do is run a briefing with their team about care. So that could be, just sharing awareness of, I've just been on one of the Leadership Academy programs. I've found out about what I've learned through the program is about the Care Leadership Foundations. This is what it looks like, and this is how it applies to us. So we've sort of involved them in that process as well, but it's also then starting to get those leaders to think about, well, what does this look like in my workplace? What does this look like for my team? And one of the other things we've done to support that is once they've run a care briefing with their team, we've designed these beautiful little care pins that everyone gets. So if you've been briefed on care, you get a pin as well as a lanyard. Now, we know everyone in the hospital setting won't be wearing a lanyard, but some people might like to stick it on their wall or put their keys on it. Do with it what you wish. But someone once said to me, nurses love a pin. So we've made sure that everyone does get a pin.
Oh, that's wonderful. Is that a pen? Oh, I was thinking here.
Oh.
Sorry, here in New Zealand.
Oh.
It's for writing. I was thinking pin. I was thinking, badge. No. That would be.
No, it's a badge.
It is a badge. Oh, okay. There you go.
It's a badge. This catches me out all the time. Someone called me out of it.
There you go. Because nurses also do love a pen.
I know.
Well. Oh, wonderful. So, how a tough question. Is everybody a leader at Ramsay? So lead different. The age-old question.
I'm so glad you asked this question. Look, we have a view. Yes, there is leadership by title, but then there's also leadership by action. So you don't need to be a leader to take an act of leadership. And it's actually one of the concepts that's delivered through all of our Leadership Academy programs.
You don't need to be a leader to take a leadership action.
Yes. So when we talk about leadership actions, it's about noticing when something needs to be done and having the courage to do something, which is a leadership action. What we see as a leadership action.
I think your answer is great. I'm I guess processing that myself, and I totally agree. I think delineating between a leadership action and a leader, is a really important thing.
Mm.
The things that spawn off for me there is things like psychological safety.
Mm.
And those other, I guess, environmental factors such that make it okay for someone to take a leadership action despite not having that maybe hierarchical influence that comes from the leader role.
Well, there's probably quite a lot of synergies there, but when we run a program of work around speaking out for patient safety, it's not too dissimilar to, when you're in a situation where you may feel uncomfortable about something a doctor's doing, or what's happening on your board. It's still, it's not too dissimilar to having the courage to speak up and to act and do something about it. That is like, I see that as a leadership action.
I would definitely agree. Okay, so that's the leadership side of things. How about the difference between leadership and management? Do you have clear thoughts around delineating between those two things? Is that well understood in the organisation?
Oh, that's a great question. Look, I think within Ramsay, the concept of leadership and management have often been confused. Sometimes when we've talked about leadership, we're actually talking about the operational management pieces that you need to do as part of your role. I think we're now getting to a point where we can start to have quite a clear delineation between what is leadership and what is management, because our care leadership foundations define the leadership capabilities, and we've designed that so it can apply to, you can take two leaders at very different areas of the business but at the same level, and those capabilities still apply to them. So we've started to be a lot clearer that, this is not just, leadership in nursing, or this is not, leadership in allied health, or leadership for corporate. So that sort of really helped us make that delineation between the two. We do run a number of programs that are more focused on the operational management areas of roles. But I think, we're getting to a point where we can actually be quite clear as what leadership is and what management is.
I think that's really good. I think defining leadership is definitely the start of that. And then noting that a capability framework is not a job description, but most of what you'll need to do as a manager is definitely in a job description. That's kind of the way I tend to think about it. All right, so that's a really good insight into what's going on at Ramsay. How do you find new ideas? Like, what's the next steps? What's years 3 and 4 involved for Beck and learning at Ramsay?
Years 3 and 4, I think one of the things I really want to focus on is bedding down our engagement model with the business. So being really clear on how we proactively engage with our stakeholders and partner with them. So I talked a little bit before about, there's always that constant feeling of being reactive to a stakeholder need. There is an element where we can be proactive. For example, I've said a number of times, we're going through so much transformation now. That means we're going to need some different skills in the organisation to help us move through that. So we can start having those sort of proactive conversations about, what are those skills? Do we build them? Do we recruit them in? And getting a really clear strategy, because ultimately that should inform the work we do as a function. So I think for me it really is around getting absolutely clear on how we engage and partner with our stakeholders. There will always be an element where we'll have a mechanism where someone can come to us with, hey, I have a need, please help me. But also being very clear about how we can help them with that need, because often, and I'm sure any other learning professional has experienced this, is someone will come to you and say, hey, I've got a need. I need an e-learning module on XYZ. And my question is, how do you know? I was like, well, how do you know you need an e-learning module? So that is really on how we consult with them, and how we, often talk with my team about performance consulting.
What's that? What's performance consulting? I've never heard that term before.
So performance consulting is where we partner with our stakeholders and be really clear on the outcomes that they're looking for. We work with them almost in a co-design model where we design together, but what we don't want to be doing is just, really receiving the order and go, great, I'll go, pump out an e-learning solution for you. 9 times out of 10, I will try to talk someone out of the solution that they've come to me saying that they need. Because what we've got to remember, and I think learning as a profession, we're terrible at this. We often let people almost kind of downplay the expertise that we have in our area. We'd never go to a legal function and tell them exactly what you need in a contract, right? So we've got to remember that, we have spent years and years as learning professionals building our capability. So it really is our responsibility to push back and to challenge and be absolutely crystal clear that we're going to deliver something that's going to deliver value and deliver an outcome for that stakeholder.
That makes a lot of sense. I think we experience a similar thing with content requests from our customers. The topic is usually a clue as to the need, but it's not necessarily, the right delivery mechanism can be overly influenced by a compliance objective as opposed to a change in care or something else. And as our team always says, education is not always the answer as well. I imagine 9 times out of 10, you're pushing back on the solution. Maybe some percentage of time, it's not even an educational solution that's needed as well.
Absolutely. And that's where we've got to ask those questions and understand everything holistically. We've got to understand, who is the learner? What is the environment that they're operating within? What is their context? What are their challenges? What are their barriers to performance? And if we start with that learner, then we can work back and try find the most optimum solution to deliver that outcome.
Well, I think, Beck, that's actually a really nice note for us to leave the conversation on. Is there anything you'd like to summarise from this chat for the listener?
I think we've covered quite a lot of big topics in the session. So thank you for having me. Thanks for having me along. I mean, I could talk about this stuff for hours. So it's always a joy to,
We'll definitely get you back on the show once your next project goes live and hear how that's going.
Great.
Thank you so much, Beck. I really appreciate it, and all the best.
No problem. Thanks, Will.
You've been listening to Outcomes, a show about uncovering the hundreds of micro innovations that help make Australia's healthcare system one of the best in the world. This podcast is produced by AusMed, one of Australia's leading providers of educational content and software to the health, aged, disability, community and allied health sectors. To find out more, head to our website, ausmed.com.au. To make sure you don't miss an episode of Outcomes, be sure to subscribe to or follow the show in your favourite podcasting app. And while you're there, please leave us a 5-star review, as it really helps others to find the show. I'm Will Egan, and I'll see you next time for another episode of Outcomes.